Welcome back to Toledo Clinic TV. Our guest for this segment is Dr. Aaron Pumerantz. He's a rheumatologist. Welcome. Good to see you again.
Good to see you again.
And so we're going to talk about osteoarthritis. It's a pretty broad topic. What's the definition of it?
Absolutely. It's broad, but actually the most common arthritis worldwide is osteoarthritis. In general, it's one of the most common arthritis that we deal with in rheumatology. It is pretty much one of the most common chronic conditions in the over 60-year-old population. So a lot of people don't realize how ubiquitous it is and how common. It's one of the most common etiologies or causes of complaints when you present to your primary care doc.
And so what might the symptoms of it be? Joint pain?
Yeah, great question. So common symptoms are mechanical joint pain. Osteoarthritis occurs in weight and load-bearing joints. So that's feet are your weight-bearing joints, feet, ankles, knees, hips, back. And then load-bearing joints, a lot of patients sometimes forget that your hands are a common source of load-bearing. Hands, elbows, shoulders. So symptoms would be mechanical pain, pain with use, pain when you get up in the morning, but typically stiffness less than a half an hour, pain when you're getting out of a chair, pain when you're using your joints.
Okay, you said this happens in an older population.
Yes.
When we get old, things just don't work as well. So how do you know when it's time to come and see you versus these are just normal things that you're dealing with when you're aging?
Yeah, great question. So really if it's impacting your activities of daily living, or if the pain is becoming a significant issue, if you're thinking about it often, really essentially any kind of joint pain is something that you should bring up to your primary care doc, and then they'll kind of figure out whether or not it's something that they need to investigate further. But you also kind of brought up a good point as far as like who gets it and what are some of the risk factors. We talked about age, and age is a significant risk factor. Other things too are injury. So as soon as you injure a joint, you're going to be predisposed to early osteoarthritis. Other things too, genetics. We know that if your mom or dad or first-degree relatives have had it at an early age, you're going to be more prone to having osteoarthritis. Those are just some of the risk factors. In addition to one of the biggest modifiable risk factors is weight. So about 2/3 of our population actually suffer from being either overweight or obese. And so that's a huge modifiable risk factor that we like to hit home on, not only in identifying those at risk for osteoarthritis, but also in some of the treatments.
That was the next question, was are there things that we can be doing to prevent
Yes.
it, aside from losing weight?
Yes, great question. So actually, right, patients come to us often wanting medicine, and the first thing that I sit down and tell them about is the best medicine for osteoarthritis is not a pill, it's actually exercise. Movement is medicine. And so studies have actually shown that simple exercise, about 150 minutes a week, 30 minutes 5 days a week of moderate exercise, aerobic exercise, is at least needed, and about 2 days of some resistance training. But resistance training can be as simple as your weight, so moving your weight, doing air squats, and then other things like yoga, tai chi can be very helpful too.
And you should start those at an early age to prevent those
Absolutely.
problems later.
But exercise is key.
Okay. What about the treatment? So
Yes.
let's say that you know,
Awesome.
they come to you and they've done the weight loss. Are there treatments available to help?
Lots of treatments, and other than the weight loss and exercise, in order to assist with all the non-medical options, we really try to hit on diet also, improving protein to increase muscle health, and then also making sure that if they are losing weight, they're doing it appropriately. But medications, they can span from NSAIDs, non-steroidals, to Tylenol. Topical meds are also pretty helpful. Topical NSAIDs, topical capsaicin. There's also a lot of other treatments that we like to hit home first before we go on to some of the more kind of bigger gun medications or the treatments that can be sometimes more invasive, like injections of steroids or even surgical options. And those other treatment modalities are physical therapy, occupational therapy for the hands, and then there are other kind of newer age medical options that are not really prime time yet, but are things that are going to be up and coming. And really, because of the prevalence of osteoarthritis, as we identified earlier, the most common arthritis, we know that there's always going to be a need for further research.
All right. Good information. Thank you. Good to see you once again.
Good to see you.